Alpha-glucosidase inhibitors. They are oral antidiabetic drugs that delay carbohydrate digestion and absorption in the intestine, thereby reducing postprandial blood glucose levels. Key examples: the first drug is Acarbose, which is the most widely studied member of this class. It is commonly used to control postprandial hyperglycemia. An important point to remember is that it may cause rare liver enzyme elevation, so liver function monitoring may be considered during long-term therapy. The second drug is Miglitol. Unlike Acarbose, it is better absorbed systemically, meaning a greater proportion of the drug enters the circulation after administration. The third drug is Voglibose, which is commonly used in Asian clinical practice, particularly in countries where postprandial glucose control is emphasized. Mechanism of action: alpha-glucosidase inhibitors target enzymes in the brush border of the small intestine, blocking carbohydrate breakdown at the source. How they work. Now let's understand the mechanism of action of alpha-glucosidase inhibitors step by step. The first step is inhibit alpha-glucosidase. These drugs block the alpha-glucosidase enzymes located on the brush border of the small intestine. These enzymes are normally responsible for breaking down complex carbohydrates into absorbable glucose molecules. As a result, the next effect is delay in carbohydrate breakdown. Since carbohydrates are digested more slowly, the conversion of starches and other complex sugars into glucose is postponed. This leads to the third step, slow glucose absorption. Because glucose is released gradually, its absorption into the bloodstream becomes slower and more controlled. The clinical consequence is a reduction in the post-meal rise in blood glucose, helping control postprandial hyperglycemia. An important point to remember is that these drugs act locally in the gut and do not stimulate insulin secretion. They simply blunt the post-meal glucose spike by slowing carbohydrate digestion and absorption. Adverse effects. The most common complaint is flatulence. Because carbohydrate digestion is delayed, more undigested carbohydrates reach the colon, where they are fermented by intestinal bacteria, producing excess gas. Another frequently reported adverse effect is abdominal discomfort, which commonly presents as bloating and cramping. These symptoms result from increased gas formation and intestinal distension. Patients may also experience diarrhea. This occurs because undigested carbohydrates remain within the intestinal lumen and undergo bacterial fermentation, drawing water into the bowel and increasing stool frequency. A less common but important adverse effect is elevation of liver enzymes, especially with Acarbose. Therefore, liver function should be monitored during long-term therapy when clinically indicated. GI side effects are the primary reason for poor patient tolerability and discontinuation of alpha-glucosidase inhibitors. Starting at a low dose and titrating slowly can minimize these effects. Clinical uses. Their primary role is to control postprandial hyperglycemia in type 2 diabetes. Since these drugs slow carbohydrate digestion and glucose absorption from the intestine, they are particularly effective at reducing the rise in blood glucose that occurs after meals. In clinical practice, they are frequently combined with metformin. This is a common first-line combination for type 2 diabetes mellitus management because the two drugs act through different mechanisms. Metformin reduces hepatic glucose production, while α-Glucosidase inhibitors reduce post-meal glucose absorption. They can also be used with sulfonylureas. This combination provides complementary mechanisms targeting different glucose pathways. Sulfonylureas increase insulin secretion, whereas α-Glucosidase inhibitors blunt postprandial glucose spikes. Another useful combination is with insulin, particularly in patients requiring insulin therapy. By slowing glucose absorption, these agents help reduce post-meal spikes and improve overall glycemic control. Summary. Let's conclude with a quick summary of α-Glucosidase inhibitors. First, regarding the mechanism, these drugs inhibit intestinal α-Glucosidase enzymes, which leads to a delay in carbohydrate digestion and slows the conversion of complex carbohydrates into absorbable glucose. The resulting effect is a reduction in postprandial hyperglycemia. An important point to remember is that these drugs cause no insulin release because they act locally in the intestine rather than stimulating pancreatic beta cells. Moving to side effects, the most common problems are gastrointestinal symptoms, including flatulence, bloating, abdominal discomfort, and diarrhea. A rare but noteworthy adverse effect is a rise in liver enzymes, particularly with Acarbose. Finally, these agents are commonly used in combinations with metformin, sulfonylureas, or insulin, providing complementary mechanisms for improved glycemic control.